Hello, my name is Theresa Bengough, and I speak to you at the 5th European Congress of Qualitative Inquiry. I'm affiliated with the Social Research Methodology Group at the Faculty of Social Sciences, as well as the Austrian National Public Health Institute located in Vienna. I have no conflicts to declare. The project I present to you today is called Factors that Influence Women's Engagement with Breastfeeding Support, Qualitative Evidence Synthesis. And as you can see in the long list, this has been a broader collaboration with a variety of international scholars located not only within, but also beyond Europe. So why did we conduct this project? Well, breastfeeding is an integral part of nutrition in early childhood intervention. It is an effective way to prevent serious childhood and maternal illnesses. Although a variety of support mechanisms are in place, many women do not breastfeed. There are various reasons for this. Some mothers may lack access to support interventions in terms of geographical distance. Other women may lack information about where to get support, or they may not see the need for breastfeeding due to a lack of information or misinformation, either about what benefit breastfeeding offers for mother and child, or specific techniques and skills that are needed to initiate and successfully continue breastfeeding. For breastfeeding support interventions to be effective, we need a better understanding of the factors that influence women's engagement and satisfaction with support interventions. The project I present to you today addresses these factors through a synthesis of qualitative evidence and was carried out alongside 4 Cochrane reviews of the effectiveness of breastfeeding interventions. The project has 2 objectives. First, to explore factors that facilitate or constrain women's engagement and satisfaction with breastfeeding support during 2 particular phases, first initiation and second continuation. And the second objective is to specifically focus and identify factors that impact on women's responsiveness to and satisfaction with breastfeeding support, and to examine choice patterns, perceived benefits, and challenges of engaging with or perceiving breastfeeding support. The methods we used is that we systematically searched for studies that used qualitative methods for data collection and analysis, and that focused on women's experiences and perception regarding breastfeeding support programs. We applied a maximum variation purposeful sampling strategy and used thematic analysis. So let me show you what our systematic search resulted in. Overall, we identified 5,075 titles and abstracts. Of these, we considered 121 full-text papers for inclusion in this synthesis. Of these, we identified 51 studies that met our inclusion criteria, and 14 were purposefully sampled. An additional sample of 8 studies was selected as deviant cases, resulting in a total of 22 full-text articles sampled for inclusion in this synthesis. Most of the studies used interview and focus group discussions as data collection methods, and only a few used other methods of qualitative data collection, such as participant observation or written journal entries with answers to qualitative questions. One study used a think aloud method when using a pictorial representation. We appraised the quality of the included studies using the CASP tool. All studies gave at least a brief description of the participants, sampling, methods, and analysis. Studies varied in the level of detail provided, but overall there was poor reporting on context, sampling frame, and research methods. As for the settings, 3 studies reported research in low-middle income countries, 19 studies took place in high-income countries. Of these, 8 studies explored support programs in a hospital or healthcare setting. 8 studies explored support programs in more than one setting, and of these 8 studies, 6 focused on routine support from the hospital staff rather than a specific support program. 2 studies explored support in a home setting. We performed data extraction in EpiReviewer using a specifically developed form that we use to extract key themes and categories relevant to the review objectives. Categories included the content of information on support programs, women's views and experiences with these programs, and the extent of its influence on their engagement with these support programs. We also extracted information about language, context, theoretical or conceptual frameworks and research methods. One reviewer extracted data from all included articles and a second reviewer double-checked it. We then used a thematic synthesis approach for data analysis. Four overarching process factors affecting the engagement with breastfeeding support programs emerged from the thematic analysis. First, information provision. Second, type of implementers. Third, optimal or non-optimal delivery modes. And fourth, the optimal maternal care pathway. Each overarching category contains subcategories, the latter incorporating several findings. For each finding, we compared what women experience as constraints or non-optimal promotion practices with their expectations of what adequate support should look like. Overall, we identified 14 findings. As this year's Congress is dedicated to technologies and digitalizations and the possibility this creates, we selected findings that answer more specifically the question prompted in the theme of the Congress. In summary, women perceived digital forms of support as beneficial when it was easy to access, and moreover, when they could decide when to access, because this was perceived as supportive, especially in situations of emergency. Women also found it beneficial when they could choose from a variety of information presented, and they liked that they had a choice what to read, what to look at, and what not. In particular, women preferred that they could touch base with a community of people who had made the same experiences as themselves. I'll give you a couple of seconds to read through the citations that we present here. To finish my presentation, I would like to present to you the major key messages that we derived based on our findings of this qualitative evidence synthesis. First, supporting women to initiate and continue to breastfeed is a complex process. Second, practitioners and service developers need to be aware that throughout the whole continuum of maternity care, women's breastfeeding support needs are dynamic, and it is unpredictable when and if challenges and needs arise. Third, the emotional and physical difficulties sometimes associated with breastfeeding may require diverse forms of support, also in combination to counteract challenges. Fourth, digital support is a relevant element of support system because it is perceived as flexible and easily available by women. Fifth, digital support is also perceived more relevant when an official association is linked to the support program and if the digital support is free of charge. Sixth, digital support programs benefit from realistic rather than idealistic content. Thank you very much for your attention. If you do have any questions, I'm happy to receive your emails.